Here is something that I want to highlight that almost nobody in this space is talking about yet. When most people hear about Ozempic, Mounjaro, Zepbound, they assume you need to be obese to benefit. And they actually picture that you need the full weight loss dose to have that dramatic transformation. But what I have found and what the emerging science supports is that even very low doses of this medication can have meaningful anti-inflammatory effect in patients with arthritis, with autoimmune diseases, and we call this low doses microdosing. Now let me tell you another story. I have a patient. She came to me from Arizona. She was already on a DMARD and a biologic. She was maximized on those, but she still had multiple flare-ups every single month. She was exhausted and she was not overweight. We started her on a low-dose GLP-1 medication, not the targeting weight loss, just targeting the inflammation. And 3 months later, her flares went from multiple times a month to just one. Her energy came back. And we are now slowly tapering her medication down. We are reducing the dose rather than escalating or changing the biologic. But why does a small dose work? Because the anti-inflammatory effect of this medication isn't purely a side effect of weight loss. These drugs have a direct impact on the immune system, on the inflammation, and that effect begins even at very low doses, before significant weight change happens. Now, this means that patients who are not overweight, patients who can tolerate higher doses, patients who are worried about the side effects, they may still have options here. This is still an emerging area, and it has to be done under careful medical supervision. It has to be for the right patient, and if it is for the right patient, it may be genuinely a game changer. But I need to be crystal clear about something before we close, because this is the most important thing that I will say in this entire video. GLP-1 medications do not replace your rheumatology treatment. Not your methotrexate, not your biologic, not your hydroxychloroquine, not your prednisone, because they are not a substitution. They are an addition. Your standard treatment is still the foundation. The DMARDs and the biologics that your rheumatologists are prescribing are doing critical disease-modifying work that GLP-1 medications cannot do. So stopping them without medical guidance could actually lead to serious flare-ups and permanent joint damage. What GLP-1 medications can do in the right patient, again, at the right dose, under proper supervision, is to remove a hidden layer of inflammation that was preventing your standard treatment from working as well as it should be. But they make the foundation work better. Now think of it this way. If you have a leaky roof and you keep painting over the water stain on the ceiling, it looks better for a while, but the leak is still there. GLP-1 medications for some patients fix the leak. The pain, which is your biologic, your DMARD, can finally do its job. If any of this resonates with you, if you feel like you have been doing everything right and you are still not getting where you want to be, so bring this information up to your next appointment. Ask your rheumatologist about metabolic inflammation and ask whether the GLP-1 medication might be an appropriate addition to your plan. And if you want a rheumatologist who thinks about all of these pieces together, you know where to find me. I will link my website in the description of this video.